Hi, everyone. It's Nancy Reyes with For Your Canine and Joanne. She's on the road, so she may not be able to get a clear clear signal. So hopefully, she's gonna jump in when she can. Um, and today we have a special guest, so let us know you're there. Today we have a Dr. Rosemary LoGiudice. She is a treasure that we have here in the Midwest. um, and one of the topics she's got lots of experience in a lot of things, different things, but one of the topics I wanted to talk about today was keeping our seniors sassy, right? We talked before we went on the air about how some people, it's a number for the dog, and then they make decisions based on the number instead of really looking at the dog. And so one of the things we want to share is some ways to keep your senior dog happy, healthy, um, and mobile, because it's not. And I'm kind of all about this, right? I'm all about quality of life versus quantity. So that's a big deal for me, and for my dogs. I want a good quality. If I can get a long quality life, yay. But I'd rather have a short quality life than a long miserable one. So, Dr. Rosemary she has tons of credentials, so I will let her tell us all about it. But she is a veterinarian, and she's done equine and small dog, and she also does a lot of. Most of you that are tuned in that are in the area have probably seen her at one time or another, or are still currently clients of hers. So I will turn it over to Dr. Rosemary and let us know how you came to be here.
Excellent. Well, thank you, Nancy. Thank you for inviting me to speak tonight. And hopefully this can be an interactive evening with people with any general questions about aging dogs. So I've been a veterinarian since 1981. And hang on a minute. I've been a veterinarian since 1981, University of Illinois grad. Did equine practice, as you mentioned, for about 20 years in the Joliet, Illinois area, and then went to work for the American Veterinary Medical Association for 9 years. And then I started missing actually touching animals. So a classmate of mine had started the Canine Rehabilitation Institute. And so I thought, oh, let's try that. That sounds like fun. Because working with the dogs on rehabilitation was basically what I was doing with horses for 20 years, keeping them healthy and sound and keeping them a good quality of life and active for as long as possible. So I got into the canine rehabilitation, and then I got into acupuncture, which I'm certified in as well, in canine and equine. And then I said, there's got to be more to it. And that's when I discovered spinal manipulative therapy. And I discovered the Healing Oasis Wellness Center in Wisconsin, where I got my training. And the interesting thing about that is that we deal primarily then with functional neurology. So it's not just, as Dr. Rivera at the Healing Oasis says, thumping on the high side. It's what's going on and why is that affecting how the animal is moving. So I blame him for ruining my ability to watch dogs in an event or watch horses in an event without going, oh, why are they moving that way? Something's up. So I love watching them move and trying to figure out what can we do to help them move even better. And that brings us to the whole thing about mobility and our seniors. If we keep our pets, whether they be a dog or a cat or a horse, moving appropriately, that's going to help them be healthy all the way around. It's just like people. Nancy and I were talking before we started tonight. If you keep active and keep yourself going, then you're going to be a young 70-year-old or a young 68-year-old, versus if you decide, oh, I'm 65, I'm going to sit in my chair because that's when I retire, then you're going to be a very old 68-year-old or whatever, or 65-year-old. The same holds true with our dogs. The better we can keep them moving, the longer they're going to have a happy, healthy, productive life.
Right.
And that's what we're looking for. if you're like me, and I'm sure everybody who's tuned in is thinking this, our dogs don't live long enough.
No, they don't.
Not, I mean, um, those of you who know me and have known me for a while know that I had a English Cocker Spaniel otter that I just thought the world of him, and we did all kinds of things together. He was almost 14 when I had to make that most loving and most difficult decision to humanely send him over the Rainbow Bridge, right? Euthanasia is probably the most difficult decision a pet owner is ever going to have to make, but it can also be the most loving decision, because there comes a time when you have to figure out if the dog doesn't pass away, are they enjoying life?
Right.
Are they able to do the daily things that they normally did? Are they miserable? So that's a difficult decision, and we want to postpone that as long as possible, but you want to postpone it for the dog's best interest, not for our own best interest.
Right. And I think that's the most challenging thing, right, Dr. Rosemary? Because we want them to stay with us, but they can't sometimes, or they shouldn't, right? Because it's not good for them, right?
Yep. So what kinds of things can we do to help to prolong the life? Well, first of all, Nancy made a comment about, well, what is old for a dog? So and that's a very individual question. I've seen dogs, and again, Nancy and I were talking a little bit beforehand. I've seen dogs that are 4 years old that look like they're old.
Yes, absolutely.
Now, yeah, maybe they have underlying diseases, and that can be a problem, and that's going to age just like a person. If you have underlying predisposed to different diseases, that's going to make you age prematurely. The other thing is, and I think one of the most important things for people to maintain is a dog's healthy weight.
Yeah.
I look at some of the dogs in the show rings, and like some of the Labrador Retrievers, for example. And I look at them in the show ring, and they're placing first and second or whatever. And these dogs probably would not last 5 minutes in a field,
right,
doing what they were bred to do. They're just too heavy. And that's not healthy. And so that's going to age an animal, because when I was in school back in the dark ages, like I said, I graduated in 1981. When I was in school, they told us that fat was an inert tissue, and that what it did was just added mechanical weight to the body. And so that's what made things difficult for an animal that was overweight. Well, since then, we know that fat actually produces inflammatory chemicals. And so if there's any underlying inflammatory process in the animal, say arthritis, an infection of some sort, an animal that's carrying extra weight in the way of fat or adipose tissue, they're producing extra inflammatory chemicals,
right,
which is making things even worse. So what I tell people a lot of times, that if they come to see me for an evaluation, and say the animal's got arthritis, it's a senior, and I'll say the simplest thing and the cheapest thing that you can do, it's in your control, and that's regulate your dog's weight. And that's going to be so helpful for every animal. And usually the weight that I like to see a dog at is an athletic weight. And a lot of other veterinarians are going to say, oh, your dog's too thin, at the weight that I like. But the weight that they should be at is if you run your hands down their sides, feeling the rib cage, you should be able to feel the ribs. Now, that doesn't mean the ribs are sticking out, but you should be able to easily feel the ribs without having to poke in very far to get to where the ribs are.
Right, right. So let me ask you. So yeah, because like my lab really wants to be a fat lab. she really, she really, that's her goal in life. so so we struggle. We struggle with that. But that's a really good I like a visual, like you should be able to feel the ribs but not see them, right? You should be able to run down their back and see them. So and like if a vet tells a person, say, hey, your dog needs to lose a couple of pounds. A couple of pounds is a vastly different for a dog than it is a human. Is that correct?
Sure. Look at the percentage. So if somebody weighs 100 pounds and you say, let's lose 2 pounds, that's what, 2% of their weight?
Right.
So if you have a dog, okay, here comes higher math here. If you have a dog that weighs 30 pounds and it's supposed to lose 2 pounds, that's almost 7% of their body weight.
Right.
So it makes a huge difference. And a lot of times, I'll give somebody an estimate of the weight the dog should lose, but I want to go by the feel. And there's another test that you can do that if you kind of pinch the skin over the side of the last couple of ribs on the dog, you should be able to slip the fat that's under the skin. You should be able to slip that between your fingers. That's a little more difficult to learn how to do than running your hands down the side of the rib cage. So I'll tell people, here's what I want to be able to feel. So let's have a goal, and I'll give them a plan of how to lose that weight, because I think that's one of the most frustrating things is for a person to be told, well, your dog should lose a couple pounds. How do I do that?
Right.
So I'll tell them, okay, yeah, you could figure out calories and do it that way, but 9 times out of 10 people are going to go, that's too difficult. And it's very difficult. So I want them to measure exactly what they're feeding their dog.
Right.
Exactly. And then I want them to only feed 2/3 that amount. So remove a third. So let's say you feed a dog a cup twice a day, and the dog is overweight. Then I say, then let's just feed the dog 2/3 of a cup twice a day. If the dog is looking to you for, like, he's starving to death, you can add up to twice the amount that you removed in plain canned packed pumpkin.
Yeah.
And that's not going to give you as much calories as what you took away, but it's going to help the dog feel full.
Right. Yeah.
And then we get to treats. And it's like, okay, what do you give them for treats? And I'll say, whatever you're giving them, don't change the frequency of the treats that you're giving, but break them in half. So if you're giving the dog a milk bone, give it half a milk bone. Contrary to popular belief, the dog doesn't really recognize that they're only getting half the milk bone as long as you make a big deal of it. They've measured the endorphin release in the dog's brains, and the thing is that they're getting the treat. Oh boy, I'm getting a treat. So if you don't increase the frequency of the treats that you're giving, but you break them in half, you've cut those calories in half.
Right.
So right there, you should lose weight.
Right. Yeah, because that's what I do when because my lab tends to put weight on much quicker than my other dogs. So I swim her a lot, so that helps keep her more trim. But that's what I do. I cut her food bag and then I just add pumpkin, and she doesn't care as long as she's eating something, so it's usually not a problem. But it's a challenge with her because it doesn't take much to put weight on her, just because of the way she's built. But I really manage it because I do want her to live a long life with us, right? So,
exactly.
it is what it is. So let me ask you, along that vein of food. Do we have to make any adjustments about what you feed your senior dog versus what you feed your young adult?
That's a great question. Years ago, we used to think that the older dogs, especially if they were getting to have any kidney issues, kidney disease or kidney issues, which is a common thing. So let me just back up 1 second. It's really, really important for and again, what's a senior dog? We have to come back to that. But it's really, really important that they get blood work done at least once a year. And as they get to be a real senior, maybe even twice a year, because now they're aging at a faster rate. So it's important to be on top of if there's any changes. So for kidney problems, we used to think, well, we better feed the dog a lower protein diet because the kidneys have to filter out and clear out the ammonia part of a protein molecule. So we want to reduce that amount of work, but that's not the case. The thing is that you have to feed them a high quality protein, so a good quality food, and that protein level needs to be at least about a 26% protein as they're older, because they have more difficulty processing and utilizing it. So they need that higher protein because it's a normal thing for older dogs to lose muscle mass. That's a normal aging process. You see that in people where they lose some of the muscle in their face and their head, and the dogs, they'll lose the muscle there in their heads, and you can just kind of see it start to sink in a little bit with where the muscle is being lost. So we need that high quality, higher level of protein.
Oh, that's good to know. Because because that's usually a big, so somebody asked if you're talking kibble or raw fed. I know there's a lot of controversy about raw feeding. I I have raw fed for a very long time, and my dogs have lived a really long time, and none of them are, related. So I know, but for some of the vets, that's a big, you know, big deal. Obviously, I buy what's already. I don't make my own because I'm not that good. So you have to have a certain. I know the measurements and all that have to be different. So I just buy the pre-made one. So they're asking if it's kibble or raw, and I'm gonna be and I just and so you can address it. As my dogs have aged, as they got older, they have decided they don't want to eat raw anymore, and we have to go to something else, because the dog tells me it's not actually, he's having either difficulty processing it, or it's not setting well with the dog. And then I had Cha-Cha was almost 14. She ate raw all the way to the end and didn't have a problem with it. But one of my other dogs that I have lost before, as he got older, he didn't want to eat it anymore. And we just switched it to, something else that he was able to tolerate.
Yep.
So if you can address that, because I know that's a big thing with the veterinarians. Some don't, a lot of them don't want you to feed raw. Some of them are okay with it. So I know it's a sticky little subject there.
It can be, and if you ask 4 veterinarians, you'll get 4 opinions. My opinion is that raw fed, as long as it's balanced, like you said, it's got to be balanced with protein and all the minerals, and handled properly, because we know that some raw foods,
Oh yeah,
chicken, whatever, they're inherently going to be more prone to bacteria.
Mm-hmm.
So you have to handle it properly. So if you process the food properly, keep it stored properly, handle it properly, and that it's a balanced diet, I don't see a problem with it personally. For me, it doesn't fit my lifestyle.
Right.
Be feeding raw, because I'm on the go all the time. So I feed usually a high quality kibble, and I tend to rotate with each bag of kibble. I use either a different brand, or usually a different brand and a different protein source.
Mm-hmm.
My thinking is, if you're feeding the same food over and over and over, and I don't think that gives the gut bacteria that they have to have a chance to really get a good balance and a good mix of bacteria.
Yeah.
So that if all of a sudden you feed them something different, or people talk about their dogs have all kinds of digestive issues, I think that might be part of it if they're always being fed the same thing. So I
Right.
rotate, and I don't usually take more than a day to switch over to the new food. It's kind of like, okay, here's half and half of the old food and the new food, and now the next day, here's the new food. And my guys have done fine. I mean, Otter did fine. He was kibble fed until, like I said, when he passed at almost 14. And it was only the last 6 months where he was actually having any kind of real cognitive and mobility issues. So,
Well, yeah, because I travel a lot too. My dog, I do have them where they have kibble sometimes. Like they'll get a kibble meal every once in a while, and they'll have raw one day, one meal, and the other meal will be kibble. And they seem to not have my dogs. Well, don't have a problem with that either because they eat everything. But I just wanted to touch upon that because I know it's a thing. Like I need both, right? So the dog should be able to get their systems where they can handle, whatever. So that you're right, they don't have diarrhea and sensitive stomachs. And my dogs, knock on wood, don't. They eat anything anytime and it's not a problem. So
I just want to make a quick comment about your observation with the dogs not sometimes wanting raw as they get older.
Yeah.
From when I learned the acupuncture and Chinese medicine at the Qi Institute, one of the things that they pointed out was that it takes energy to process raw food.
Right.
And so as a dog ages, sometimes they can't use that extra energy to process the raw food. So what sometimes is recommended is that if you're going to do raw, you braise it to at least start a little bit of the digestive process that cooking does. Right. So braise the meat, and so you kind of start that process for the dog because it takes energy to digest raw.
Yeah. And what I ended up doing with Bandit was I ended up home cooking, cooking for him because for that very reason, he couldn't process that raw and the kibble either. So I just was home cooking for him towards the end of his life, and it was fine. It was more work for me, but it was fine.
Right? Exactly.
He deserved it. Somebody was asking about vitamin D, and Mary was asking about omega-3 supplement. If you need to change it. I know I used the one that you recommended years ago, and it's been a game changer for my dogs. The omega benefits, but do you change those? Do you change that as well?
I don't. I had been using a different omega product for myself and my dogs, and I noticed that they always had fish smelling breath, and I was always belching up. I felt like a perch after I took my fish oil. So I switched over to the omega benefits and their people line, and I've just been absolutely thrilled with that product. It's a very pure product. And one of the things with the omega is that you have to give it in a high enough quantity of the two main components are DHA and EPA are the two main omega-3s that you want to feed, but it has to be in a high enough level. So one way to figure it is that if you give 15 milligrams per pound of DHA per day, that should be a sufficient amount of EPA coming along if it's a product for dogs, and if it's a product that has been third-party tested so that you're sure that what's on the label is what's in the product.
Mm-hmm.
That's one of the biggest problems with supplements. There is nobody that's checking to make sure that what's on the label is what's actually in that product. So it could say it's got whatever in it, but it may have none of it in there because there's nobody checking. But if it's third-party tested and research backed, then it should be okay. And so I don't change the omegas. That I switch. Once I found the product that seems to work, I stay with that.
Yeah. I think you told me about that years ago, and I've been on it for my dog, and it's really been, especially that's why Cha-Cha was in such great physical condition all the way to the end of her life, right? I mean, she did not have old doggy stuff going on for she was fine, she was healthy and fine until she wasn't, and that was it. It wasn't a long decline or anything like some of my other dogs have had. And somebody was asking about vitamin D, about giving them vitamin D.
So you have to make sure you don't give too much. And some of the omega products have vitamin D with them to help absorb the omegas. So vitamin D is a fat soluble vitamin. So that means it's stored in the body, in the fat. So you don't want to give too much. Unlike vitamin C, which is a water soluble vitamin that if you give extra, it just passes out in the urine. And the same with like B12 is very similar. You can give a little extra on that. But the vitamin D, you want to make sure if what's in the food and what's in your omega product is sufficient, you don't want to give too much.
Right. Okay. All right. So the next,
So,
Joanne, go ahead.
Sorry. Yeah. And I hope I didn't miss you saying something, but how do you feel about vitamin C, since it has some like anti-inflammatory effects?
So vitamin C, I have no problem with vitamin C, giving that as a supplement. It's a water soluble vitamin. It's not going to cause any problem. It has some anti-inflammatory effects, some antioxidant effects. So not a problem whatsoever.
Okay. Somebody said the omega about the fish oils, about if that would be good for dogs that have arthritis.
Yeah. Given in the correct dosage, the high enough dosage, the EPA and DHA omega-3s can block the inflammatory process in the body almost as well as a non-steroidal anti-inflammatory. So almost as well as giving them something like carprofen, Rimadyl or Metacam, something like that. So yes, and that's the same for people too. It blocks that inflammatory process, but it has to be given in that higher level than some of the products have as their label dose.
Okay. All right. So, all right. So that was good. Yeah. Cause the food is a big thing. And I know there's so much controversy about it, but, I wanted to touch upon it. So my other question was, exercise, right? Like how much exercise do we really want to give? Because some people can overdo and some people don't do enough. And I think more often than not, it's not enough. I see that more than having too much. Would you agree?
Yeah, I think so. And there's got to be a balance, just like with people. It's starting out with puppies. You have to do age appropriate exercise, and that can be a whole nother hour presentation some other time with puppies. But Dr. Chris Zink has got a really good guideline on age appropriate exercise that you can look for online and see for puppies. As they get older, you have to make sure that you're not overdoing. But now you've got a big period of time between puppy and older. So let's go back and think what's older. Smaller dogs tend to live longer than bigger dogs, and that has to do with part of the genetics and parts of their DNA that we won't get into. So a little dog may be considered old at maybe 8 or 9. Whereas, say, a giant breed dog, a Great Dane, may be considered old at 5 or 6. That might be old.
Right.
But the biggest thing is, what's the dog telling you? Is the dog acting like they're old or not? So the exercise, the biggest things that I like for people to make sure that they're doing is maintaining the best possible core strength. So that's abdominal muscles, the iliopsoas muscle. People don't think about the iliopsoas muscle as being a core muscle, but because of the length of that muscle and where it goes, it starts up in the chest area by the diaphragm and runs underneath the vertebrae and goes all the way to the upper part of the upper back leg of the femur. I mean, that's a huge, long muscle. So it's very important that the iliopsoas be strong, that it helps to maintain the dog's top line, and that helps to maintain the core strength along with the abdominal muscles. So you can do some simple exercises that will help to maintain core strength. Three-legged standing is one that I like, where you just lift one front leg, have the dog balance 30 seconds to 90 seconds, and you see how long the dog can handle that, and then you do each leg. As the dog progresses and gets stronger with that, you can challenge them, have it do it on a couch cushion or something that makes it a little more challenging for the dog to stand. Little things like that can be really, really beneficial for helping core strength without pounding the dog's joints.
Right.
Backwards walking is probably one of my favorite exercises because it makes the dog use its back legs in a way that they don't usually use the back legs.
Right.
And dogs don't usually use their back legs on their own. They, as you know, they have to be taught awareness of where those back feet are, and people don't think about that. Dogs put 60 to 70% of their weight on the front end. Any quadruped does that. A horse does it, dogs do it. So they tend to not use the back legs unless you train them to use those back legs. And backwards walking makes them have to use those back legs. And if you've tried backwards walking, you can feel that your quads are being used in a way that you're not used to having them use, as are your hamstrings. Same thing with our dogs. And then if you even backwards walk them up a little incline, that's really good strengthening exercise. And again, it's a low impact exercise. It's just walking.
Right.
And so it's really going to be helpful. Those are some of my favorite things: the three-legged stands, the backwards walking, just for starters.
Yeah. Yeah. Those are, because that, like I do under a tread with Tango just because of his rear. So he gets that all the time. So how do you, because one of the things with arthritis, a lot of people, by the time they notice the dog has arthritic, it's pretty arthritic at that point,
Yep.
right? Some of
Yep.
us that do dog sports and things like that might notice it a bit sooner because we spend a little different time with our dogs, but sometimes, the dog's really arthritic by the time they get to the vet because they don't notice the small changes.
Mhm.
And what are some of the things they can look for that might say, oh, maybe I should get him into the vet, see if he's arthritis, or starts having it develop, so you can kind of get ahead of it a little bit.
I
Well,
think
I was just going to say, on top of that question, since we were talking about exercise, and like I have a 10-year-old border collie who is dumb and loves the ball, right? Who I know has some issues, like talking about arthritis and things to watch for of dogs that are ridiculous about a certain toy, the ball, the frisbee, right? What are things to watch for that you can see that stuff is coming as well?
Yep. So one of the things with the three-legged stands is that if, say, once a month, you actually time how long the dog can do their balancing on three legs and keep a chart of how long that they're saying, maybe. And if a younger dog, you don't even have to do the charting once a month. You might do it every couple of months. But if you start to notice that the dog is having a little more difficulty or not able to stand easily balancing on three legs, maybe 4 seconds less sometime, you might go, oh, I wonder why that is. And
Right.
that might be a first indication that there's a little bit of discomfort. And oftentimes the first discomfort on especially our athletic dogs that we're going to find is in the lower back.
Mm-hmm. Yeah.
And so the other thing is that I know a lot of the people that I talk to and that I see in the dog sports get routine spinal manipulative therapy for their dogs. And people say, well, my dog's doing fine. I don't need it. And the most fun that I have is that when I go, well, let's just adjust and see what happens. Let's evaluate. And I'll adjust the dog or what have you. And then I'll get a phone call and go, they'll say, what did you do to my dog?
Yeah.
And I go,
Yeah.
why? And they said, he's running around like crazy.
Yeah.
He's jumping on the couch. I didn't realize that he hadn't been jumping on the couch the same way. He'd been climbing on the couch one leg at a time.
Right.
Those little subtle things that you get used to day after day. The cool thing about spinal manipulative therapy, in my mind, is that we can find subtle changes before they become a clinical problem.
Right.
So I'll feel that there's less mobility between vertebrae or in a joint than there should be, and then we'll go, why is that? And stay on top of it. But if you're not one that gets this routine spinal manipulative therapy for your dog, at least do that periodic 3-legged standing and chart how long the dog is able to do that routinely. Also make notes of things that your dog does all the time. Do they jump in, up on the couch? Do they jump on the bed, or are they starting to maybe have to take a running start at jumping on the bed?
Mm-hmm.
Little things that they're still jumping on the bed, but is it still with the same vitality that they've done?
Right.
So that's one thing.
Yeah, no, I agree. That's I start my dogs with chiro really young, so they get used to it. You obviously don't have to take a really young dog as often as you do an older dog, but I do have, even if they're young, just young, because especially when they're young, they do dumb things and jumping on, running into stuff and all that. So I still, that's kind of a big deal for me. So I always do. But, and as they get older, I mean, when Chacha she was going for chiro almost every month because she was getting older and I wanted to keep her comfortable. And yeah, it's a big, huge difference. And we are lucky, those of us that live in this area. And I don't know about where Joanne lives, but in our area,
here too.
Yeah, we are fortunate that we have chiro and alternative therapies are very abundant here versus, because I've been in other parts of the because I travel to do seminars and stuff.
Mm-hmm.
I've been in other places, they don't have access to that. They don't have vets in that area that do that, and some people have to travel hours to go to a chiro vet to be able to get that done. So we are very spoiled here that we can make that happen and get that done. So
and acupuncture is another thing that is very beneficial for senior dogs. Well, it can be beneficial for all dogs, but especially for dogs with arthritis and acupuncture. I mean, they're using it now. I hear it advertised for people as a complementary therapy or an integrative therapy with traditional medicine as well. So that's another thing that we have at our fingertips.
Right. Because one of those of my regrets with Cha-Cha, she never needed really acupuncture, and then when she could have benefited from it, maybe, I don't know, she wasn't able to get it because she was already sick. So it was something she could do, but it's something to definitely think about and get them going. But we are very fortunate in this area. We do have access to a lot of, and then you guys are producing lovely, wonderful veterinarians that can do that work. So that's awesome too. So that helps. Okay. So, go ahead.
Sorry, I have one more question. So when you're talking about, like, you notice the dog needs a running start for things, climbing on the couch versus jumping on the couch. How do you feel about the use of pet stairs to, like, prevent further damage or strain on the dog? Is that better or worse than trying to have them use their bodies?
Well, that's a great question. If you're going to use pet stairs, you have to teach them to use them when they don't need them. Because a lot of times by the time they need them, they're like, no, I don't know what this is. And this is scary, doing these stairs, and that's silly. I just want to jump up by you. So teach them to use that sooner rather than later. And the similar thing with ramps. A lot of people want to use a ramp, but unless the ramp has a very shallow incline, the ramp can be more difficult for the dog to climb up if it's a very steep incline than stepping up onto the couch. So, and the ramp has to be one that's very sturdy, because if the dog starts to go up the ramp and the ramp is kind of flexing in the middle, that might scare the dog and they don't want to use the ramp. So teach them to use these things when they're young. And I would say, especially a dog that has a long back, that might be more prone to back injuries and neck injuries, like dachshunds, basset hounds, that sort of thing. The long back dogs are going to be more prone to injuries. So anything we can do to help to prevent injury, but to keep those core muscle strength. If we keep the core muscle strong, iliopsoas, abdominals, whatever, that's going to help support that spine. So those exercises are really critical that we start doing when the dog is young.
Mm-hmm. So somebody, and I did have this question too. Aaron was asking, the other therapies like laser therapy, and the sissy loop, and mats, are those, I mean, that as your dog gets older, and that's a whole bunch of stuff that a lot of us that have been working with you and other chiros that we use on a regular, the laser therapy, because I know I do. I've used all of the above, the back on track coats, the sissy loops, and the mats and things like that. So what are some of those, and then laser, because I use laser quite a lot as my dogs got older. Not with my current dogs, I don't need it, but I've needed it with my other dogs as they've aged.
Yep. So I've had people ask, well, should I have my dog get laser therapy? And I say, okay, so what's wrong with your dog? Well, he's getting older. Well, you're going to just laser the whole dog. First, you need to have a diagnosis. So what, your veterinarian has got to say, okay, the dog has lumbosacral arthritis, or SI joint arthritis, or hip joint, whatever, elbow joint arthritis. These are real common things. Once you pinpoint an area, providing there's no contraindications, so like cancer, you don't want to do laser therapy directly over cancer, right? Because it stimulates growth, and we don't want
that. Right.
We want cancer to be stimulated. So yeah, laser therapy is fantastic used appropriately. In the CC loop, I usually travel with one so that if there's something that happens to me, I didn't it, or my dog, I can do an CC therapy. It's a very safe therapy, and it's very effective and has good research behind it, especially on disc disease. The CC mats, a lot of people love that because then the dog can just lay on the mat, and if there's any discomfort, the theory is that then that will help to be relieved. All their pulsed, I use also Respond has a pulsed electromagnetic mat, a PEMF mat that I've used for probably since 2009 when I first learned about it. So all those therapies can be very beneficial once you know what is going on with the dog. If there's, or a mat that they can lay on could theoretically even be a preventative type of, or a maintenance type of therapy, because it doesn't have to be localized like a laser therapy. Laser therapy has to be in a precise area. Right. So I think they're great. They can be great therapy. And I also use the back on track coats for my dogs.
Yeah. I used it for my lab Kaiser many years ago. The back on track was really very effective for him. Cha-Cha, I didn't see it make as much of a difference for her, but maybe it's because she didn't have as much arthritis, and she didn't have as much going on as Kaiser did, so it was much more helpful for him. And yeah, they were asking about the perf mats. Actually, I've been thinking about getting some for the facility, because the other bonus, and I'm not sure if you've heard about it, and this is from a behavioral, using the perf mats are really great before you work with a dog reactivity. It's supposed to help something, I don't know, something in their brain. I want to look at it, but even still, having a mat at work for for somebody who's maybe slipped or whatever, since we do so much agility there, might be good to have at the facility, just to have people that can use it. So,
well, one quick story. When I was doing my rehab training, it was back in 2009, and we had golden retrievers that were there that we were practicing on. And when they weren't being used for practice, they had two of the pulse electromagnetic field mats for the dogs to lay on just while they were waiting for us. And this one day we noticed that both golden retrievers were on one mat. So we, and they were kind of fighting over the mat. And so we got the one dog up and they put it back on the other mat. And then that dog got up and he went back with the other dog. Well, we realized the one mat had turned off. And so evidently the dog could feel the difference. And so when we turned that other mat, plugged it back in, turned it on, then the two dogs were happy each laying on their own mat. So.
Oh, that's good. That's
yeah,
good to know. That's good to know.
Pretty cool.
Oh, that's what Dr. Dan, PMF produces more delta waves in the brain. That's why it's effective for behavior. That totally,
yep.
That's what it was. It makes sense.
Yep. And a CC actually has a product strictly for cognitive and for reactivity. They've got a product that's a little bit different than the regular Assisi loop.
Mm-hmm.
And there has been some research now for doing laser therapy on the brain and helping for cognitive dysfunction.
Yeah. Yeah. So somebody asked, what are your recommendations for the best use on the back on track coats? Because that's a really good question. Like some of these things, like for example, Tango slipped on the ice a little bit. Not bad. I didn't see him limp. I didn't see him have any issue, but I thought it was a pretty big spill. So I immediately put the Assisi loop on him to hopefully fend off any inflammation or anything like that. So I looped him 3 times over the day and a half. And again, it could be that nothing happened and he was fine, or it could be that that helped keep the inflammation down. But I was concerned that he would, come up lame and all that stuff, but he didn't. But I used the CC loop right away. So
yep.
Like when do you like the back on track coat? Is it when they're already achy, or do you use it preemptively? You know what I mean?
So the theory behind the back on track, it's a ceramic fabric that helps to warm and increase circulation. So if it's a warm day and the dog is properly warmed up, I may not use it before they work, but I may put it on afterwards just to help level out the circulation. If it's a cool day and they're going to be doing something, I'm going to probably put it on before and after they work, so that when I'm walking them afterwards, after they work, and if it's cold out or cool out, I don't want that cold air right on their backs and on their the heavier muscles. So I'll use it both before and after if it's a cool day.
Oh, that makes total sense. Yeah, because
another thing that I want to that's one of my pet peeves, and especially on older dogs, because they may not wear their toenails as much as a younger dog. Toenails, they've got to be short. The longer if the toenail is too long, it changes the angle of the dog's foot and legs and puts abnormal strain on their tendons. Older dogs don't need that. Younger dogs don't need that, especially if they're athletic. So theoretically, when a dog is standing, you should be able to take a thin credit card and have it between the end of the toes and the ground. There should be enough room to slide that credit card, or a little thin plastic card, between the toenails and the floor that the dog is standing on. So that's how short toenails should be.
Mm-hmm. No, that's great. Yeah. I'm a toenail fanatic, so
yep.
we talked about
and maybe it goes back to my horse days when the hoof angle changes how the horse moves. It's the same thing with our dogs. They've got to be able to break over those toes.
Right. Especially as they get older, you know
yep.
what I mean? What was my other question? So I know we touched upon it a little bit earlier for dogs that do performance, whether it be agility or nose work or barn hunt. We want to keep the dogs that are able to work and play and do sports as long as possible. But what are some of the tips you can give? Like, this dog probably is not physically able to do the sport anymore. And I know some of them are so obvious, but sometimes we probably need to be assessing those as our dog gets older, right? Because I think sometimes we have the opposite. We have some dogs that retire dogs way too young. The dogs need to still keep doing stuff. And then we have other people that have dogs that really should have been retired years before that keep them, going. And they, it's one of those things the dogs will let you know, but there are things you also need to be looking for when their performance starts to decline a little bit, right? Like,
Yep. And some dogs will let you know, sometimes it's painful to watch some dogs in the ring because they're having a hard time going over a jump. They're having a hard time with the weave poles if it's agility. If the dog is still excited and happy to do it and not having problems, then I would let them continue to have fun, maybe go preferred, drop the height. Dogs sometimes, like labs, they would go until they drop dead. If it's something that, especially if it's a ball, if it involves a ball or food, they'll just keep going and going. And so somebody has to be the adult in the room and realize that the dog is having some difficulty, maybe losing their footing, more than they did. That's one of the things that I'll look for. Is the dog having to take hours to recover? They're sleeping for hours after they get done with an activity instead of being on the way home. They sleep on the way home, and when they get home, they're ready to go. And now maybe they get home and they're still tired. That they're telling you maybe back off a little bit. But
right.
If the dog is still having fun and maybe they're 12 and they're still running and playing, don't retire them just because you think that they're 12 and they should. 12 is a number. But I've seen 12-year-old dogs that are fantastic and still want to play. And I've seen 6-year-old dogs that should be retired.
Right.
So a couple things real quick. Other products that are available. Adequan is something that a lot of dogs can benefit from, as it's an injectable product. But I teach clients to give it a lot. But that is a very good product to help the cartilage on the joints. And you can I've started my own dogs when they were like 2. When they're working hard, I think it's probably partly maybe a preventative to help that joint and cartilage health. So that's something that's really, really good.
Yeah, that's a great idea of using the Adequan as a preventative, because I've always used it as, they're already older and they're starting to, but I haven't really even considered using it as a preventative. So would you give the Adequan as often? Like with Cha-Cha, she was on Adequan on a regular dosage every 3 weeks as she got older.
So some of the label dose says to give the amount twice a week for 4 weeks.
Yes, once you load.
Yes. And then what a number of us in the sports medicine world used to do then is twice a week for 4 weeks, then once a week for 4 weeks, and then a decreasing dose until you get a maintenance. Well, now some of the research and some of the people doing clinical trials are finding that doing it twice a week for 4 weeks as needed may be a better way to go, because it takes 72 hours for the Adequan to reach peak level in the bloodstream. So some of the thoughts is perhaps if you're using it as a preventative, maybe twice a week for 4 weeks, a time or two a year. And then if the dog is having issues, twice a week for 4 weeks, maybe 4 times a year as needed. For dogs that respond well to getting it, that decreasing dose, and maybe get it once every 3 weeks, once every 2 weeks, whatever. If they're doing well on that, I wouldn't change it.
Okay. Yeah, I think about that with Tango because he's such a big dog. He's enormous. So to keep him as as mobile as possible is really a something I think about. So that's something I never considered, because that's a great idea. Amy Barth had a question. She has she was thinking about, I'm going back a little bit to the the PEMF bed.
Yep.
She has a dog with IVDD.
Yep, intervertebral disc disease, so back issues or neck issues.
So he's very mobile, but he has an occasional flare up. So would those beds be of help for him?
Definitely.
Okay.
Yep. In my opinion. Yep.
Okay. Yeah, because I would say it sounds like it would be, right? And then
And also maybe, maybe back on track jacket might help some as well in a different way, just to kind of help keep the muscles from cramping up. But the pulse electromagnetic field is definitely, especially the Assisi, they've got good research on their products.
yeah, okay. All right, yeah, because I was just thinking about that. It's like yeah, it would make sense. It would be beneficial for that. Yeah, because I think, and Dr. Dan says that's his opinion too. Dr. Dan is in Indiana, so he
Yep.
he handles all those folks there. I know a lot of people that go to him.
Well, I've known Dr. Dan for a long time.
Yeah, now he's serving the greater Indiana area now.
Yep.
So he's
Well,
got his
the
hands full with those folks
scary
there.
thing is I knew him as a pre-vet student, so there you go.
Oh my God. It's like the animal world is so small.
Yep. Another thing, antioxidants are an awesome supplement to be giving, especially senior dogs. Resveratrol is one product that actually has good science behind it. So that's one that I would recommend to give dog as they become older, as kind of a preventative, not necessarily waiting until they have a cognitive issue. So
Right.
resveratrol is one that I really like.
Resveratrol. Oh yes, I've heard of they have that for people too, don't they?
Yes, definitely. Yep.
I should probably get that
A
myself.
lot of people talk about Myos,
Yep.
the egg yolk product
Yep.
for muscle, and that seems to be working very well on both dogs post-operatively and maybe to help slow some of that muscle loss as they age.
Well, and I'm gonna give you a quick story. I rescued one of those beagles from the Invigo
Oh,
lab.
wow. Yeah.
Right. So she had been in a crate or a cage or whatever for a year. She was a year when I got her. So I noticed she was slipping, like just walking, slipping and falling. I guess because she had very little muscle development because she was, in a cage the whole time.
Right.
So I put her on Myos, obviously got her out and stuff like that. It was like, I mean, I don't give it to her too much anymore because I've had her for now 6 months. And it was a miracle how quickly her muscles developed when she was out and about, and the Myos kind of helped move that along a little bit. Because at first I didn't give it to her, I didn't think to, and then somebody thought, oh, you should give her the Myos to see if that helps, and it did, like incredibly quickly.
Yep.
It put muscle mass. I mean, she's not like Arnold Schwarzenegger or anything, but she's able to that whole that walking around, getting around, not a lot of slipping and falling anymore. So it was very interesting how quickly that worked in that scenario, right? She was just,
Yep.
it was very, very fast. And Tango's on it again. The name of the code, Tamara, is Back on Track. It's called Back on Track. They have stuff for people too.
Yes. I've got some of their shirts.
Yeah, me too. I have a shirt. The Omega product is Omega Benefits. I will go to it and I'll put the link in the thing because that is something that I've been using forever. And they have you can have a subscription to it, which is what I do. And they just deliver it to your house every,
Yeah, they're really easy to work with. And then their joint product I like as well, the Osteo True Benefits. I'll use that. Dasaquin is another one of my favorite joint products, Dasaquin Advanced. So those are just some things. What else?
Yep.
Yeah.
I put it out there. So the link for the Mega products. Like I said, I've been using it a lot. Dr. Rosemary should definitely get some royalties on that. She recommends it so much.
It's stuff that I use for my own dogs. I like the science and the research behind the products. That's one of the things. There's all kinds of stuff that's available, and much of the products that are available, there's no science and research behind it. And so people will ask me, what about giving my dog this product or that product? And I'll say, boy, they have good marketing, but I find no science or research behind the product, so I can't recommend it.
Right. No, I am with you. They're really like I've been using it, and it's wonderful, and I can't complain. I've had all my dogs on it. So I wanted to talk. I know we were gonna we have a little it's close to the hour, but I definitely did want to talk about um, Blasto. And I want to do, well, because we had a client of ours, both of our dogs got that at our place. They've survived it, but it was a long road. And, and I know, one of the things that it's especially those people who do field work or are out in the field or do hiking. I wanted to kind of bring that to, because that is really important, and it's very prevalent in the Midwest, right? It's something that we have here more than certain other places in the country, right? And I say this, we back when AKC first started doing scent work, one of the things they did was they have a buried element in scent work, and they used to do it where they put the thing in the odor in the ground. And I'm going to be honest with you, I wouldn't. At that time, now it's changed. Now it's much easier, so it's not a problem now. But um, I would be very hesitant to put stuff and go different places and dig up the ground, given that our area is that blasto is so prevalent in our area. So I was like, yeah, I'm not doing that.
Yeah, yeah.
I'm not doing it because in other parts and to be fair, other parts of the country don't have that problem as much as
They
we
don't. It doesn't seem to be as prevalent. Wisconsin has probably some of the highest percentage of blasto cases in people and dogs. Um, and why are we hearing more about it lately? My own theory is that, okay, blasto is where there's damp, moist ground, vegetation, riverbeds, what have you. We're getting lots more developments, housing developments in areas where it's wooded and where it's, nice countryside and what have you. So ground's being dug up that hasn't been dug up. And so that releases some of these fungal spores, the blastospore, perhaps. I don't know. That's just my own thought. But dogs get it by inhaling the spores. And if your dog is, especially if they're a field type dog, their nose is down on the ground and they're sniffing the ground and looking for things. My own dogs, being hunting dogs, I test them for blasto every year, just because I figure if it comes up positive, and it wasn't positive last year, at least I know it was a recent infection, because blasto mimics so many other diseases. It can look like a cold. They can just be coughing. It can be a skin infection. It can be a lameness. It can be an eye infection. It can look like almost anything. And so by the time you treat the most common thing, as a veterinarian, you're going to treat the most common problem. Right. And so by the time you go, well, that didn't work, and then you go, well, maybe we should test for blasto. Now maybe it's been several weeks, and so it's just something that I've done for probably the last 8 or 9 years, is just test my dogs for blasto every year, and it's a urine test, so it's not just the common test that you run with everything else that you should check for every year.
Right. And blasto it's a fungus that the dogs inhale.
Yep.
And then especially that's why those of you who take your dogs hiking or that do a lot of field work, it's really something that and I'm going to be honest, I've never done a blasto test on my dogs ever. Granted, I don't do a lot of hiking either, but but I did it when I used to do tracking with my other dogs. But now, since I don't do that so much, but now I'm looking to go back to do some shed hunting. So now I might start looking to do. So when a dog gets blasto, how long does it typically take for the infection to surface?
That depends. I know that sounds like a really cop-out answer, but if it comes out like a respiratory infection, it depends on how severe the infection is. You'll see some dogs that maybe they have a little mild cough, and so you don't think anything of it. So it can take anywhere from a couple weeks to months, depending on how it manifests itself. Does it come up like a skin infection or an eye infection or a respiratory infection?
Oh, so Chris asked about that if you have a mulch in your backyard that if you're having mulch in the backyard is conducive to blastofungus. I don't think so. I think
Probably not. Unless you've got a real moist area where it shouldn't. The mulch itself shouldn't be a blasto issue.
yeah. Well, but yeah, because I think a lot of the blastable cases I've known of, the dogs are either doing field work or they're out doing hiking or they're out in they're out in the big open fields and things like that. So I think I've not heard too many people get blasto in the backyard. You know what I mean? I mean, unless they renovated a bunch of stuff or something like that.
Right. Or if they're along a creek bed or something like that.
Right. Yeah. So that, it would have to be very specific. It's not, otherwise you'd have so many dogs having blasto with people with
Right.
and all that. So
Yep.
yeah, I would suspect that. Kim asked about what brand of Reservatol.
Well, I used to use for otter, VetraScience makes a product it's called a Canine Senior Vitality Pro. It's like a daily chewable vitamin, and it had a nice resveratrol ingredient in it. That's what I use. There's a lot of different products. I don't know if your veterinarian might have one that they use, but I used to use the VetraScience product. Again, they had good research behind their products.
Yeah. All right. Does anybody have any questions that they would like to ask about their senior dogs? Because I think we've kind of covered it. One of the things that we really want you guys to is really, it's very dog specific. And you want to, and I know we had Dr. Simon about doing as your dog gets older, and Dr. Rosemary touched upon it as well, as having your blood work done more often as they get older, having it done every yearly, then every 6 months as the dog ages. It matters because you can catch a lot of stuff pretty quickly on that stuff. So just to think about that, their diet and then keeping them active mentally and physically is really, really important.
And nose work is a great activity for senior dogs because it doesn't tend to be physically taxing, but boy, the mental work is tremendous for them.
Right. All right. Thank you so much, Dr. Rosemary.
Thank you.
Appreciate it. And I will definitely have to see you soon. I need to bring Tango in for a re-eval anyway. So
yeah, he's doing good.
All right. Thank you so much. Thanks,
you all, everybody. Appreciate it.
And we'll see you all next week. Bye.
Bye-bye.